And on the line with us is Alye Senger, a health policy analyst with the Heritage Foundation, heritage.org, the conservative think tank here in town. Alye, welcome to the program.
Hi, thanks for having me today.
Thanks for joining us. And by the way, you can be tweeted at ALYENESENGER. Do I have that right?
Yes.
Great. Okay. Alye, the Heritage Foundation is I think, uniquely positioned in this whole healthcare thing right now, because you guys are the ones who came up with what became Romneycare and what became Obamacare, and or the Affordable Care Act. It was originally, proposed by Richard Nixon in 1972, and Ted Kennedy beat it back, because it wasn't single-payer healthcare. But how do conservatives reconcile? How does the Heritage Foundation reconcile the fact that your plan got put into place as Obamacare and is being vilified because, oh, geez, it was a Democratic president, God forbid?
I think you've definitely mischaracterized what happened in Massachusetts and Heritage's involvement there, and then also the Affordable Care Act.
Well, this is what Mitt Romney said.
Well,
he got the idea from you.
No, I think what you're confusing is that the Heritage Foundation helped Mitt Romney develop a health care plan, and then that plan was significantly changed by the Democratic legislature there. So while they did participate in the beginning of that plan, that's not the plan that became law. And so saying that the Heritage Foundation wrote that and then wrote the Affordable Care Act just simply isn't true. The Heritage Foundation has been against the Affordable Care Act since before it was passed, and ever since. We've been fighting this law and its intrusion into Americans' lives for the past 7 years.
So it's an intrusion into our lives to have health insurance?
Well, it's an intrusion when the federal government takes over state insurance markets, tells everybody what their health plan has to cover, and then forces people to purchase a health care plan.
But that was part, the individual mandate was specifically part of your original Heritage Foundation program. That was the key to it.
No, I'm sorry, that's not true. That idea was originally discussed in the late 80s, but is completely different from what got included in the Affordable Care Act.
Okay, well, setting aside Heritage's role in this, and I defer to you. You work there, I don't. What parts of the Affordable Care Act do you want to take away from Americans?
Well, we want to repeal the whole law.
Okay, so you want to go back to the. I remember my wife had breast cancer, and the treatment was quite expensive, and we were about 4 months before the Affordable Care Act came into law. She got a letter from her health insurance company saying, you're near your lifetime limit, we're going to drop your coverage. And so you want to go back to that. You want to go back to saying to women who have breast cancer, sorry, you're going to have to die.
Our position is that the law be repealed and then replaced. So
okay, we
certainly support
when you replace the law,
market regulations, but what we don't support is Obamacare's $1.8 trillion worth of new health care spending and 18 different tax hikes.
Yeah. Alye, talking over each other really works well on Fox News because they got people who pot up the conservatives and pot down the liberals. But, we're both at the same volume level here. So if we talk over each other, nobody can understand what either one of us is saying. So specifically, what does this plan offer somebody like my wife who now has a pre-existing condition?
This plan you're referencing being the Republican replacement plan?
Yes.
Well, the conservative solution to that would be that if you haven't maintained continuous health coverage, you can't be charged more by your insurer when you try to switch a plan or denied coverage. It's a pretty sensible rule. It already applies to the vast majority of Americans that have their health care coverage through their employer. We just simply extend those simple common sense rules over to the individual market so that people could be protected there as well.
So what happens if my insurance company messes up or I move and I don't get the bill in the mail and I don't pay it on time, and so I'm 1 day late, my insurance coverage has technically lapsed, and I'm telling you, this is not some weird scenario that I'm coming up with. Hundreds of thousands of Americans have had this happen to them prior to the Affordable Care Act over the last couple of decades by health insurance companies. And then they say, now you have a pre-existing condition and you can't be covered. Sorry.
I think there are reasonable solutions for that person and that problem. So rather than your coverage being canceled on the very first day it's late, you could impose some type of grace period.
Allie, why should we have health insurance companies at all? It's a serious question. Why should a banker be between me and my doctor?
I think that you're right, and that the third-party payment arrangement has significantly been a detriment to our healthcare system. I think that to the extent the consumer is not really in charge of their own healthcare dollar has been a bad thing. And we should get reforms that connect consumers to their healthcare dollars rather than just simply having your employer pick your plan and then you deal with your insurer. And they
so you're suggesting if Louise's treatment cost a couple $100,000 that if I can't pay it, she should just die?
Wow,
that's my wife.
Very extreme.
Well, that's what you just said. You were just
accurate
weren't you just saying that having third-party payers, that would be either health insurance companies or the government, is not a good idea? That people should be responsible for their own health insurance, their own health costs.
Cost inflation that's happened in our country. You're grossly mischaracterizing the policy solutions that I'm representing here today.
How? Did you not just say that having a third-party payer is not a good idea?
Okay. You're wow.
So, well, back to my original question. Why do we have banksters? What is good about Stephen J. Hemsley, the CEO of United Healthcare, taking over $1 billion in revenue out of United Healthcare and having over 100 executives who make more than $1 million a year, and every penny of all that money that went to him, to them, and to the other stockholders of that company, every penny of it came out of somebody saying, no, Allie, we're not going to give you a liver transplant. No, we're not going to vaccinate your child. No, we're not going to pay for that. No, we're going to send, the bill, 2 or 3 times and reject it 2 or 3 times until finally you hassle us enough to pay it, which is what everybody who's dealt with health insurance companies has experienced. Why should we be giving 20% of our healthcare dollars, skimmed off the top, 25% for the smaller companies, and that's by law now. I mean, it used to be 30, 35%. Just 10 years ago. Why should we be giving 20 to 30% of our healthcare dollars to banksters?
The point of health insurers is to pool risk so that you pay a premium into the system for the unfortunate event that you get sick. You'll have an insurer to pay for your very expensive healthcare treatment.
You're absolutely right. So why should that be for profit? In the 1970s, I was running businesses in Michigan. At that time, Michigan had a law that said health insurance companies must be not-for-profit. And we had a factory with 18 people. It was 1973. And I remember we paid $35 a month for the health insurance for families, for all of our employees. It was cheap. The hospitals had to be not-for-profit. And this was the state law at the time. Hospitals and insurance companies had, and we had Blue Cross Blue Shield, and it was not-for-profit. Why should we be giving our healthcare dollars to for-profit banksters instead of having a third party? If we're going to have a third-party payment system, instead of having a third party that operates on a not-for-profit basis, whether it's like Switzerland does, where it's all the health insurance companies are required to be not-for-profit, or whether it's like the rest of Europe does, where the government provides it on a not-for-profit basis. Why not? That's an honest question.
Sure. And I think that the private market provides better health care at a cheaper rate that's higher quality for the vast majority of Americans, especially when you compare it to the single-payer health care system that exists in the
No, I'm not talking about health care. I'm talking about the payment for health care. United Healthcare, Stephen J. Hemsley has never given anybody a vaccine.
It provides incentives that are beneficial to consumers. If you take a look at the VA healthcare system, where that's a single payer,
that's a socialist system.
The doctors, the hospitals, and pays all the bills. How's that working out for the vast majority of veterans?
Well, the Veterans Administration is not a single payer system. It's a socialist system. It's like the United Healthcare, or it's like the healthcare system in the UK.
There's one payer. It's the government.
But no, but the people who actually provide the health care are employees of the government. The buildings in which they do it are owned by the government. That is basically socialized medicine. That's what the Veterans Administration is. What I'm talking about is single payer, Medicare, Medicaid, having a third party that operates on a not-for-profit basis. What advantage is there to society?
There are nonprofit health insurance companies today.
Of course there are. But none of them control the kind of market share that the for-profit ones do. I'm sorry, I didn't hear what you said.
If you'd like to purchase your health care coverage from a nonprofit health insurer, you're able to do so today.
I can't here in Washington, D.C.
I'm sorry?
I can't here in Washington, D.C. To the best of my knowledge, there are no not-for-profit health insurance companies offering services, offering health care here.
Well, why? You have to ask yourself why. I mean, take a look at the nonprofit health insurance companies that were created under Obamacare. That's what the co-op program was. Were those successful?
No, they weren't. Because of the competition. I wouldn't even say competition, because you've got these for-profit companies that, and you know this, Allie, you live in Washington, D.C., you work in this town. You know, some of the biggest campaign donors in this town are people in the health. In fact, I would say probably the biggest campaign donors in this town, between pharma and the banksters who call themselves health insurance companies. Are, you know, they're buying politicians left and right. How does that help? Well, that's a whole other conversation, I guess. But so just to boil this down, because we're running out of time here and we're going to hit a break. We're talking with Alye Senger of the Heritage Foundation. What should we expect under Republican Congress, Republican president, using your template? What are we going to look at? What are we going to be seeing here?
We're going to see the repeal of major parts of Obamacare through the reconciliation process. That repeal will most likely be a slow, smooth transition repeal where no one's going to lose their health care coverage that they got under Obamacare the day that the bill gets passed. There's going to be a smooth transition until the replacement plan is able to be implemented.
So the replacement plan will do what?
Well, there isn't legislative text for a replacement plan yet, but there are lots of different plans offered by various members, and all those plans center around the same basic principles of, one, getting the federal government out of the regulation of health insurance and devolving that back to state governments, and two, providing some type of individual tax relief to help people offset the purchase of their coverage in the individual market.
So you want to use taxpayer dollars to subsidize this?
Well, it's their dollars because they're paying taxes for it, so it's just that they get to keep a larger share of their own money, depending on how you structure that tax relief, of course. There could be a refundable portion for very low-income people who don't have any tax liability but still would like to purchase health insurance.
That's Mitt Romney's famous 47% of all Americans, for whom tax deductions do nothing.
Exactly. So you could potentially have a refundable tax credit or some other form of individual tax relief.
Are you suggesting high-risk pools and individual health savings accounts? We've heard these things before from conservatives.
Certainly, those can be elements of the replacement plan, but I think the focus generally has been on creating that individual tax relief so that people that don't get their health care coverage through their employer are able to access equitable tax relief in the individual market as they purchase on their own.
How is that different from simply expanding Medicaid? Oh, it keeps the for-profit insurance companies in the loop. I get it.
Medicaid.
Is that right? I mean, this is about, you know, like you've got what, about a third of America on Medicaid?
This is about giving people the same tax relief that the rest of us are getting through our employer plans.
Right.
So that they can purchase a private health care plan of their choosing.
From a for-profit company.
If they choose that they would like to do that, then they would have this tax relief to offset the cost of that coverage. Okay.
Alye Senger, thank you for the conversation, for coming on the program today.
Thanks for having me.
Great talking with you. That's Alye Senger with the Heritage. Heritage.org is the website. The Twitter account, ALYENESENGER. We'll be right back.